Nice to meet you. Okay. Before we do anything today, I'm going to pop on my latex gloves, okay? Absolutely essential that I'm wearing gloves throughout all of today's examination for hygiene purposes, of course. Okay, so if you'll excuse me for just a minute. Okay. That's it. I've got them fitted to perfection now, and that's just how I like them. Okay, right. The first thing I'm going to do to you today is a sharp or soft test. Okay, for this we're going to be utilizing the special cotton bud. Okay, special because one side is soft, as you can probably see. There, that's quite soft, isn't it? And this side is a little bit more pointed. You might say it's sharp. Okay, obviously it's not actually sharp, but for the purposes of today's test, it will do perfectly fine. Okay, I want you to close your eyes, please. Okay, and I'm going to poke you in random places on your face, and I want you to tell me if it's sharp or soft. Okay, so here we go. First time now. Sharp or soft? Very good. Sharp or soft? Very good. Here we go. Sharp or soft? Very good. Here we go. Sharp or soft? Very good. Sharp or soft? Very good. One last one. Sharp or soft? Very good. Okay, excellent job. You can open your eyes now. Very good. Okay, now what I need to do is I need to palpate your face. Okay, that's just a fancy way of saying I need to poke your face a little bit, tap your face with my fingers. Okay, so I'm just going to be tapping your face a little bit, Okay, and I'm just trying to see how your facial muscles react, basically. And also I'm trying to see if there might be any twitching, anything like that, okay? Any sort of unexpected response. Also, I'd like you to tell me if you experience any pain or discomfort. Okay, so how was that? Did you experience any pain or discomfort? No, all okay. Very good, excellent start to the exam. Very good. And now I'm just going to quickly check your reflexes. Okay, so if you could hold your arm out straight for me, please, just like that. Very good. And I'm just going to 3, 2, 1. Very good, very good. If you could hold out your other arm for me, please. 3, 2, 1. Very good. Okay, now I just want you to drape your knee over just like that for me, please. Just bend it ever so slightly. Perfect. Okay, I'm just going to give that a little tap. 3, 2, 1. Very good. And if you could do the exact same thing with the opposite knee for me now, please. Very good. 3, 2, 1. Excellent. Very good reflexes. On point. Very good. Right, my next little test for you, still involving your external limbs, your extremities. Okay, I want you to hold out your arms for me, just like this. Okay, just hold your arms out like that for me. Very good. Okay, I'm going to place my hands on top of your arms. I'm going to push down. I want you to resist and to push upwards against my hands. Okay, so here we go. Okay, very good. Now I'm going to be putting my hands underneath your hands and your arms, and I want you to push down. Okay, and I'm going to be pushing up. Okay, very good. Now I want you to push against my hands. I'm going to be pushing inwards. need you to make some silly facial expressions for me, okay? So if you could grin for me, please. Grin as wide as you can. Bare those teeth. Okay, very good. You can stop now, that's fine. And can you make a sad face for me, please? A sad face for me. Okay, very good. And I want you to frown as much as you can for me, please. As fiercely as you can. Frown. Okay, very good. And I want you to act surprised. Okay, so raise those eyebrows as far as you can. Very good indeed. And now I want you to blow out your cheeks for me, please. Blow out those cheeks. Blow out those cheeks. Marvellous. Okay, you look very good. You look very good indeed. That's a great sign. You've performed excellently well during all of those tests. And that's just to take a look at your muscle strength performing certain movements. Most of that is what that's about. Okay, so what's next on the old cranial nerve exam? Let's have a look, shall we? Let's have a quick look. What have I got in store for you? I want you to follow my finger, please. Okay, so keep your head still and use just your eyes to follow my finger as it moves about. Okay, looking at the tip. Looking at the tip of the finger. Just use your eyes to follow my finger as it moves about, and I'm just going to be looking at your eyes as you do this to see the health and the quality of your eyes. Okay, we're going to do this on the other side now, just so I can get a better look at this side. Very good, keeping your eyes focused on my finger as it moves about. Very good job indeed. Very good job indeed. Okay. Excellent. Excellent. Let's see. What's next? What's next? Let's have a quick look, shall we? Right. I need to inspect your eyes further, and to do that I'm going to use a light. Okay. Okay. Now I'm just going to bring in this blue light. It is quite bright, so I'm going to hold it a bit further back. Okay, let's repeat the previous experiment where you follow the light for me, please. Follow the light with your eyes. This time, obviously, the light is affecting your irises and their dilation, okay? And I'm just going to be looking at how they're behaving with a combination of light exposure and movement. Okay. Absolutely marvellous. Let's move on to the other side again, just for me to get a different perspective on your eyes. More than anything, just to confirm my findings. Okay, keep following that light for me, please. Doing absolutely marvellously. Well done, well done. Okay, very good job. Now I want you to focus your eyes on my nose, please, okay? And what I'm going to do is I'm going to flash up a number of fingers in various different places, and I want you to tell me how many fingers am I holding up. Okay, so here we go, starting now. Very good. 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 Very good indeed. Well done. Now I want to do the finger wiggle test. Okay, so still keeping your eyes focused on my nose, please. I'm going to wiggle my fingers in various different places and in various different ways. Something like that, or like that. And I want you to tell me, please, which finger is wiggling, left, right, or both. Okay, so starting that now. Good. 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 Very good. 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 Okay, very good. I'm just looking at your peripheral vision during these exams, and now I want to try and mark the edges of your peripheral vision, so to speak. Okay, so if you could focus on my nose once again, I'm going going to move my fingers in various different directions like this, and I want you to tell me when you can no longer see them. Okay, so we're going to begin doing that test now. Very good. Do a different direction. Very good. Another direction. Marvelous job. Marvelous job. I'm going to take a step away from you now, quite far, and we're going to perform the exact same thing, okay? I'm just going to ask you to focus on my finger, and the finger's going to move a little bit closer to you, okay? A little bit closer, a little bit closer, a little bit closer. And then it's going to move further and further away, and I need you to continue to focus on the finger at all times, please, okay? At all times. Just going to repeat this motion a couple of times, okay? And this is just to allow me to see how your eyes behave in regards to focus, okay? And I want you to pay particular attention as to whether or not you experience double vision during any portion of this. So if you see two fingers as opposed to one, okay? So how was that? Did you see two fingers instead of one at any point? No. Excellent. Okay, that's a good sign. Right. I think it's time for the eye chart. Right, I would like you to remain standing where you are, please. And don't lean forwards, don't lean backwards, okay? We're going to go through this quite quickly. What is this letter? This letter. This letter. This letter. Marvellous job, okay. And how about these colours at the bottom? Okay, what is this colour? That's green. What is this colour? That's red. Very good. Can you cover one eye for me, please? And I'm going to point at random lines that I want you to read out for me, okay? So here we go. This line here. What is that line? Very good. How about this line? Can you read that line out for me? Very good. How about this line? Very good. How about the final line? Can you read that? Okay, very well done indeed. If you could uncover that eye and cover the opposite eye for me, please. Same test. Can you read this line for me, please? Now this line for me, please. Now this line for me, please. And now this line for me, please. Very good job indeed. Very fast as well. That's good. You can uncover your eye now. Okay, I do want to just perform a split vision test very quickly. And for this, which light do I want to use? Yes, this one here. Very good. And I want to pop my hand along your nose to split your eyes, so to speak. Okay. And now I'm going to put the light on here. As you can probably see, it's only been exposed to the one eye. Okay. And I'm just going to be observing how your eyes are responding. Okay. Obviously the light is only going into one eye. Just going to see how they behave, okay? And now I'm going to be doing it in the opposite eye, okay? Let's have a look. Light's going on, very good. Oh, can't I'm just going to be using an otoscope to look into your ears. Okay, we've done with the examining of your eyes section of the cranial nerve exam now. So I've got this lovely, clean, fresh, brand new nib on the otoscope, of course. Only the best for you. I'm just going to be quickly looking in your eyes. Okay, so let's have a quick look in these eyes of your ears. Sorry, I forgot what these were called. That's not very good for a doctor, is it? Not very good for a doctor at all. Okay, a little bit of earwax build up, but nothing too excessive. Nothing that I wouldn't expect to see in the average person, okay? And once again, just going to be looking in your ear over here this time. Looking in your ear over here, your ear over here. Very good. Very good. Very much the same as the previous ear. Little bit of earwax build-up, nothing to be too concerned about. There's no redness, no sign of soreness or infection, which is very good indeed. Have you experienced anything negative with your ears recently? Pain, discomfort, loss of hearing? No, everything's been good. Okay, I do just want to quickly whisper a couple of words or numbers in your ears, and I want you to repeat back to me, please, what I whisper. Okay, so we're going to do that now. Coconut. Coconut. Very good, very good. Okay. Technical. Technical, very good. Okay. Asparagus. Asparagus, very good indeed. Okay. Spaghetti. Spaghetti, very good indeed. Okay, we're going to do a couple of numbers. 792. 792, very good, very good. Okay, here we go. 83. 83, very good. Okay, I'm happy with that. We're going to be doing one last very rudimentary hearing test now, and that is basically I'm going to be creating a noise with my gloves. I'm going to move my hands further and further away from the sides of your head, and I want you to tell me when you can no longer hear the sounds. Okay, so we're going to start that now with both ears. Okay, very good. We're going to do just the one ear. Very good. The other ear now, of course. Okay, very good. We're going to repeat the experiment just for a little bit of very good. This ear. Good, this ear. Absolutely. Well done. Perfect. Okay. So I'm satisfied with your hearing. I think it's very good indeed from what I can see. Anyway, next test we are going to do a taste test. This is quite exciting. I like this part of the exam. Okay, I've got 3 artificial flavors for you. I'm just going to quickly grab them for you. Okay, and we have here artificial flavor number 1. I'm just going to shake it up very quickly and then pop a little bit on your tongue. Okay, I'm just going to be putting a little bit on your tongue. Right. Okay, so if you could stick your tongue out for me, please. Very good. I'm just going to drop a little bit on there. And what does that taste like? Coconut. Very good indeed. Okay. Artificial flavor number 2. Let's go. Sorry, I do need to shake them up just a little bit because they do sit on the shelf for quite a while. There is no expiration. It is an artificial solution, but artificial flavour number 2 tasted like papaya. Very good indeed. Very good indeed. I love papaya. I love papaya. Excellent fruit. Right, we're on to the third and final artificial flavour for you to identify, okay? Third and final. Right, are you ready? Okay, just a little droplet on your tongue there, little droplet. Very good. And what does that taste like? Coffee. Coffee, yes, coffee. Very good, correctly identified all 3 flavours. Now that is a good sign indeed. Now, we have a very similar series of tests for you. The smell test, okay? And I have 3 artificial scents for you to smell. Once again, I just got to shake up the bottle for you, a little bit different consistency. These smells more gel-like as opposed to liquid, I suppose. Higher viscosity. Okay, so I'm just going to open this. And if you could prepare those nostrils, okay, take a good sniff of that for me, please. A sniff. And what does that smell like? You want to smell it again? Okay. A bit of trouble, maybe a blocked nose. Have a sniff. What was that one? Mint. Very good indeed, okay. Moving on to scent number 2. I'm just going to monitor how well you do with the remaining 2 smells. Okay, it is possible perhaps you just have a little bit of a blocked nose, okay? Not necessarily a big deal, doesn't necessarily indicate any problem, okay? So, let's have a smell of this one, shall we? What does this one smell like? Lavender. Okay, very good. You managed to identify that one quite quickly. That's promising. That's very good. Okay, third and final smell. Let's just give it a little bit of a shake up, shall we? A little bit of a shake up. Prepare the smell for you. Okay, here we go. The final smell. Have a little bit of a sniff of that. A sniff. What does that one smell like? What does that smell like? Lemon. Very good. Okay, so you did correctly identify all the smells in the end. It just took a little bit of time for you on the first one. I don't think that's a big deal. I don't think that's an issue at all. Okay. Well, I have to say, I believe that's the end of our cranial nerve exam today, and I think you've performed very well indeed on all aspects of the examination. Eyesight, very good. Hearing, very good. Sense of smell and taste, very good. And of course, your ability to physically move, the strength of your muscles, your sense of feel, for lack of a better word, your feeling, all seems to be working in tip-top condition. Okay, so I'm satisfied that you're in good health, and I don't think there's any need for further testing or anything after this, okay? So I'll just be sending your results and my write-up, my report of today's exam to your general practitioner, and they'll probably have a chat with you, just a routine chat, just to confirm that everything is okay with you. Okay, so you can expect to be contacted by your doctor in perhaps 1 week, something like that. Don't worry if it takes 2 weeks though, maybe he's lazy, might be a bit lazy, might be busy. Okay. Thank you so much for coming in today and for performing so well during the exam, and also thank you just for being so pleasant